Hi, everyone. Thank you for inviting me to this wonderful webinar, and I'm so excited to kind of share a little bit about results. I am currently finishing up my sabbatical at Stanford University, but I'm originally stationed in South Korea at Sungshin Women's University. And I do have to say, despite being in Silicon Valley, my internet is not very good. So hopefully I don't cut out in the middle. So today I'm going to talk about two studies that I've been working with Nanit on. And I'm sure if you're a parent who has been losing sleep because your child isn't sleeping through the night, you can definitely empathize with this picture. And parents will really do anything to help their child sleep. And kind of to give you some context of why I became interested in infant sleep. I was originally an adult sleep researcher. I'm originally stationed here in South Korea. And in the Far East, we have a pretty notoriously low rate of implementation of behavioral sleep interventions, where Dr. Khan mentioned earlier, things like modified extinction or unmodified extinction, etc. And only when we did a survey, only about like one in four parents actually said that they were implementing behavioral sleep interventions. And this is quite like almost a little less than half of what Dr. Khan had discovered earlier. So we kind of went about, no one had really looked at sleep with mothers in South Korea. And, we kind of have this culture of co-sleeping, everyone kind of sleeps in the same room, in the same bed, and, often till their kids go off to like high school, it's actually quite an older age where everyone kind of sleeps in the same room. And the problem is when I was doing my clinical work, I was running into these mothers who just complained and complained of how their sleep has never been the same since they had a child. So we kind of got together this focus group interview of mothers who were complaining about that their child's sleep was actually interfering with their own sleep. And these are some of the things that we heard. Things like, I try my best not to be a judgmental mom, but if you do cry it out, you're a terrible mother. Or kind of surrounding feeding. If you feed the baby anytime he feels sleepy, because hopefully it'll guarantee that the baby will sleep longer. Not being at the beck and call of the child, or feeling that they should kind of be on call all night just in case their child needs them. So these were all some thoughts that mothers were talking about in clinic. And my background is as a stress researcher, and this is kind of, if you're in sleep research, you're probably very familiar with the 3P model, where it says that if you the way that you develop insomnia is that you start off with some predisposing factors, and usually it's some kind of precipitating event or a precipitating factor that kind of takes you over the insomnia threshold. And usually that for most people is a stressful event or a major change in life at the beginning of the onset of insomnia. And we kind of really forget how stressful being pregnant or giving birth is for a lot of mothers. These are two really famous stress researchers that kind of compiled a list of all the stressful events that could happen for a person. And what we found was that pregnancy or gaining a new family member was really a high up on the list, even higher than like death of a friend. So, these are really stressful times, but we never really think about it. And according to the 3P model, eventually the stress goes away. But what happens is the reason why a lot of adults continue to have sleep problems is because they kind of form these maladaptive cognitions that maybe perpetuate their sleep problems. And so I was really interested in this piece because it really hadn't been studied a lot before. So we're really interested in kind of more focused a little bit on the mother's sleep disturbance. And see if I can, I don't know what that is. Okay, so mothers who have children with sleep problems reported higher levels of postpartum depression, their own physical problems, more limitations in daily life, and it actually spills onto kind of how they attend to their child. They're probably more angry at their child or yelling at their child a little bit more, have more poor mental health. And kind of the role of this parental cognition in child health and child sleep is that it kind of predates how they behave. So the way that the mom thinks about their child's sleep is actually determines kind of how they're going to act during the night. Like, for example, like checking on their child multiple times a night, or kind of like immediately going if they hear the slightest sound. And that actually may kind of condition the infant to wake up a little bit more frequently. And, we have people who have published on this right now in our symposium, but, there has been previous studies that have found that maternal cognitions do predict infant sleep and also maternal soothing behavior as well. So we developed this questionnaire with Nanit and a bunch of sleep researchers spanning 4 continents. We called it the Pumbaa Q questionnaire, and kind of we wanted to make it a little bit more culturally inclusive because some of the questionnaires that have measured maternal cognition actually kind of assume that maybe individual sleeping and sleeping apart from the parent was more of the norm, and that really wasn't the case in a lot of Asian countries. So I'm not going to go into too much detail, but these are kind of after we did an item generation, and then we let the statistics do the work. We came up with 23 items with 4 subscales, and these are some of the question items that we came up with. So, for example, misperceptions about the child's sleep are things like, oh, if I don't know what my child needs at night, I'm a bad parent, kind of having some judgment about themselves or their kind of judgment as a parent, or misperception about how they should intervene as a parent. So if I don't respond right away when my child cries, it will negatively affect his or her emotional development, or misperceptions about feeding. So my child is waking up at night because he or she is hungry, or kind of just general anxiety about being a parent. So, I'm afraid my child might die unexpectedly if I don't sleep with him or her, things like that. So these are just some questions that we came up with. And based on that, we wanted to see if it really could kind of associate with actual sleep. And we used the Nanit to look at some of these, and here's some interesting things that we found. We're in the process of publishing the paper, but what we found was that the higher you score on this Pumbaa Q questionnaire, and parents did actually have more insomnia on their own. So respondents in the highest tertile did have the highest ISI scores, which is an insomnia severity index, which indicates that you have higher insomnia scores. And also, it did reflect also on the way that the baby was sleeping as well. So the first and second graph that you see here, these are all groups that are divided into tertiles based on the Pumbaa Q scores. And I'll just focus on the one on the far left, but this is objective total sleep time of the infant. And as you can see here, the higher that the parents had in terms of maternal cognitions about their infant's sleep, the more maladaptive they were, the less that their infant was actually sleeping. And it was kind of this nice graded effect that we saw. And also in terms of sleep quality, this was also measured by the Nanit. And as you could see, the sleep quality was also the worst for those who had the highest Pumbaa Q scores. And also in terms of the way that the parents behaved during the night, we were really excited to find this, but actually the more higher cognitions that the parents had, the more frequently they actually came into the crib and intervened with their child's sleep in the middle of the night. So this is kind of what we're seeing here, and the less confidence they had about their parenting skills as well. So based on that, after we found those findings, we kind of went through this phase and we did the scale validation. And now currently we're working on developing a cognitive intervention for parents, specifically targeting the cognition. So we know that we have all these behavioral sleep interventions that work, and a lot of them are very focused on the behavioral part, and we don't really kind of give a lot of thought on why people have knowledge that these interventions exist but still don't follow through with them anyway. And we kind of propose that maybe there is some type of cognitive work that might need to be done to get the parent there. So the main purpose of the intervention was to kind of enhance, kind of educate the parents on what their child looks like. For example, around 6 to 8 months of after birth, most children actually do have the ability to self-soothe and fall back asleep on their own if they do wake up. But a lot of parents don't know that, and they think they're being a good parent by intervening frequently during the night. And also, any type of misconceptions or cognitive distortions that they might have about their child's sleep, we wanted to kind of target that and see if we can modify that to kind of help them, maybe think or even behave a little bit differently regarding their child's sleep. So we call this the sleep intervention for mothers and babies, the SIMBA study. I know we are a little bit we're fans of Disney, so we kind of had a Disney theme going on there. And this is a scalable intervention. We just started, so I don't have a ton of data to show you, but it was 3 core sessions, and then those who needed it, we added 2 sessions. They were weekly. We realized that this is a time where a lot of mothers have a lot on their hands and are very, very busy. So we utilize telemedicine. We do most of them by Zoom, and then we also want to be flexible. So if they can't make it to Zoom, we might use a telephone intervention and do something like that. And we base it on a cognitive behavioral framework. So basically, we want to kind of identify some of the thoughts that they might have, and then kind of try to test whether these thoughts are actually valid or true, or actually, not based on evidence, and see if there's different ways, more adaptive or realistic ways of thinking about it. And we do use a little bit of cognitive behavioral therapy to do the cognitive restructuring part. And also a big piece of the intervention is doing psychoeducation. So kind of what to expect their infant's sleep to look like and how an infant normally develops. And then things like identifying child sleep problems, and then kind of maybe even modifying how they could modify problematic sleep associations. But this is not a behavioral intervention, so it's more based on kind of providing education for the parents. And then we do a little bit of relapse prevention. So the study design is there's the core intervention is 3 weeks. We collect baseline data, and then we collect it 1 week after the final session, and then at 1 month and 3 month follow-up. And there was a lot of measures that we're interested in. The primary outcomes we're interested in are the PUMBA-Q questionnaire that we developed, and a sleep diary of the parent's own sleep. We also gave the parents Fitbit so that we can measure their objective sleep. And then we're also implementing the Nanit, where we'll be looking at things like the infant nighttime sleep duration, number of times they wake up during the night, and how many times the parents intervened during the night. So this is just some preliminary data that I wanted to show you. This was one person that was in the intervention group. And she was a 28-year-old woman with a mother with a 13-year-old girl, and only had 1 child. They were sleeping in the same room, but they were kind of like had these 2 beds kind of put together, but they were sleeping in separate beds. And when I talked to her, so I did the intervention, and when I talked to her, she was saying, "Oh, my daughter wakes up for hours in the middle of the night, won't go back to sleep unless I pat her or on the back or hold her." And she was complaining that she had never was able to put her child to sleep lying down. So she was always holding her upright until she fell asleep, and then putting her down. And you can imagine how much physical effort that really entails. So the goal that she identified was that, in the middle of the night, she wanted her child to try to fall back asleep by herself. And we did kind of emphasize that this wasn't necessarily a behavioral intervention. And one of the things that really kind of stood out for this case was that she had this thought that, everything was her fault. Like, she was all the reason why the child was waking up in the middle of the night was her fault. And if it wasn't her fault, it meant that it was the child's fault. And she could not deal with that. And so there was a lot of all or nothing thinking, kind of how she should behave as a parent, a lot of judgment about what she was like as a parent. And so, throughout the intervention, we really worked at kind of chipping away at some of these thoughts. So, like for example, the way that a child sleep, we would talk about different determinants. Just because she did everything perfectly didn't necessarily correlate with how the child slept well that day. Just because the mother was kind of like slacked off during the day doesn't mean that the child wouldn't sleep well that day. We kind of broke apart some of those associations, kind of looked at some of the should statements that she was having in terms of, this is a little psychological lingo, but like, I should be able to know when to wake up my child from a nap, or like a lot of these things, and kind of had put a lot of empathy around it in terms of, she was a first time mom. Nothing in her life that she did she excelled at the first try, like things like that. And eventually, like at the end of the intervention, one of the despite not being a behavioral intervention, she started putting her child to sleep lying down. And she reported that she was less likely to intervene during nighttime awakenings, and she was putting her child to bed for multiple naps during the day. And kind of based on her child being 13 months, she probably didn't need that anymore. So, kind of providing that education helped her. So, at the end, these are some of the alternative thoughts that she came with. Like there are many other factors besides things that I'm doing that can contribute to how well or how bad my child's sleep is. And my child has the physical ability to soothe herself, and I just need to have that trust and give her the chance. So these are just some of the more adaptive thoughts that we were able to do throughout the sessions and the work with her. And this is just some data that I wanted to show you. The blue line is our one person in the treatment group, and the dotted line is our one person in the control group. But if you just focus on the blue line, this is the one participant that I worked with. After the first week, where she was waking up around 80 minutes after falling asleep. I mean, that's a pretty large number. And during this whole time, she would be holding her baby and patting her on the back. And, she kind of weaned that off a little bit. And by week 2, we didn't tell her to do this, but she started it doing on her own. And at the end of the intervention, her wake after sleep onset was down to about 4 minutes. And she was waking up a lot less, and she wasn't necessarily sleeping a lot more, but we were really excited to see that she wasn't like waking up in the middle of the night. So in summary, parental cognitions about infant sleep are associated with how the quality of the parent's sleep, especially, getting worse and having higher insomnia severity. And also these are precipitated by things that are like, having to make frequent parental visits during the night, having less confidence about their own parenting. And these cognitions are actually associated with behaviors and also outcomes. So, things like shorter total sleep time for the baby, lower objective sleep quality. And we noticed that most sleep interventions for children are mainly focused on behavioral interventions, things like, establishing sleep routines, cried out, graduated extinction, increasing self-settling skills, etc. So there really hasn't been a lot of focus on kind of doing a little bit of the work around parental cognitions as a target for intervention. And and we do think that this is a modifiable factor that could be a good target for kind of increasing the implementation rates of interventions, and even children, hopefully with sleep disorders as well. And I also wanted to add that, I noticed that a lot of the studies that Nanit has been doing has been mainly looking at naturalistic observations and kind of associations, but we were really excited to kind of use Nanit as tracking progress for a specific intervention, and hopefully that will kind of guide a lot of other researchers to do the same, because I do think it is a great device. So this is my team, our Disney team, and this is our lab, and I've had some really wonderful collaborators and great funding resources, and we're really excited to continue our work with Nanit and in this topic. Thank you very much, and I'll be happy to take questions if there are any.